And joining us in the studio now is Dr. Richard Colgan, Associate Professor of Family and Community Medicine at the University of Maryland School of Medicine. Doctor, thanks so much for being with us.
My pleasure, Jeff.
We're seeing an increasing debate out there about whether the annual physical is necessary for most people. How do you see it?
Well, I think it depends on who that person is and what their age is. Certainly gender comes into play. But those between the ages of 20 and 40 have been coming into doctor's office for years, sometimes requesting annual physicals. And I think some of the trends you're hearing about now are, is there a value in a young man who's otherwise healthy or a young woman coming in every year?
I think in my 20s, yeah, maybe I did it once through the whole decade in my 20s, and I don't think I missed anything.
I think you're probably right. In your 20s, some authorities say that you should have a checkup, a health maintenance exam, a physical about twice in your 20s.
Yeah.
Some would argue that that's superfluous, it's not necessary, but I'm still in favor of regular checkups, well visits, because a lot can happen during that visit.
And certainly when you start life and you're seeing a pediatrician, you do need to go in on a regular basis, and that declines over some period of time. And then later in life, you need to go a bit more often, I suppose. So it's in that middle where it's a little fuzzier?
Yeah, I think it's in that middle when you're feeling pretty good, but that's when some silent diseases can creep up on you. And I do believe in and support the fact that once you get their blood pressure checked in their 20s, if there's a family history of coronary artery disease, it's a great idea and recommended that you get your cholesterol checked. But speaking of cholesterol, that's probably one of the few blood tests that's actually really indicated in your 20s if you're otherwise healthy without other risk factors or other risk for other diseases.
Within the medical community, is there agreement on who should get an annual checkup?
No. I don't think there is. I mean, I think what prompted this interview might have been the New York Times article, but even that's not much news, because in 1979 the Canadian government had a task force out that said they recommend against annual checkups, but instead they recommended for more periodic health exams. So this has been kind of kicking around for about 30 years, and there's no edict that I'm aware of by some certain major bodies that said you should do this checkup on this age group at this time, but rather there's some recommendations about specific tests such as pap smears, well woman exams, prostate cancer screening tests. Yeah,
I saw that New York Times story, and it looked at the backtracking on some of those tests. The prostate test, the PSA has come in for a lot of criticism. I think it was that article or another one said that 80% of urologists think it's a good idea. 20% of primary care physicians think it's a good idea, and it's the same test.
That's exactly right.
Right.
Yeah.
So who should get one of those?
Well, a fact that should be kept in mind is that 80% of men by the time they reach 80 will have prostate cancer. So most men.
But it's not going to kill
exactly
a small fraction of those people.
Exactly. So most of us, if we live long enough, will get prostate cancer, but will likely die of other things. So it's a difficult decision, and I kind of wrestled with it this week when I saw a patient in the office, and what I've been doing lately is at least bring up the conversation, bring up the discussion. Have you heard that there's lately been a recommendation against screening for this? And if a gentleman doesn't have prostate cancer in his family and is otherwise not with other risks, I've tried to let him know what some people think are the pros and cons about it, and let him choose.
So the pros are you might catch something early. The cons are you might have a false positive that sends somebody off for all sorts of testing.
Exactly.
And the evidence is, at this point at least, that it hasn't changed the level of fatalities from that disease.
That's my understanding as well.
Similar debates over mammograms, pap smears?
I think similar debates, yeah. I think basically, big public health bodies are saying, is this the best way to spend our public health dollars? And with regard to mammograms, they're scaling back from once every year to every other year. And same thing with pap exams in young women now. The amount of women you need to screen to pick up cervical cancer is exceptionally large, when this disease rarely affects young women under age 20. So the latest recommendations by the American College of Obstetricians and Gynecologists calls for doing a pap exam at age 21, whereas in the past it was to have a pap exam 3 years after a woman becomes sexually active.
So I'm not hearing you say don't get these things. I'm not hearing you say get them automatically every January 1st.
Right.
It's a little more situational.
Exactly. So there's guidelines out there which are beacons of light by experts who look to try and bring us evidence-based medicine and give us some of the science behind ideas like this. There's also standards of care, which is what would the average practitioner do in the community. But in the long run, I think what really matters is that doctor visit, that meeting between the physician and his patient, whereupon they can talk about things, they can review the person's past medical history, family history, have a dialogue, and decide what's right for that individual patient.
Let me remind our viewers, if you have a question on the subject of annual physicals or anything else medical, give us a call. We'll have the number up on the screen. Let's talk about your book for a second. I have it here, Advice to the Young Physician on the Art of Medicine.
Yes.
Coming up on its second printing. What's it about?
It's a book that looks to teach medical students, residents, young doctors, and clinicians in any of the caring professions how to practice the art of medicine, not based upon my opinion, but on some of the lessons of some of history's greatest physician educators over the past 2,000 years. I wrote the book because I noticed a lot of young doctors had heard of the name Hippocrates or Maimonides or some of the other great physicians, but when it comes to practicing the art of medicine, there's still a lot we can learn from these great figures that I thought we could still use today.
Well, give me an example.
An example is that most people know that Hippocrates said, "First do no harm," but he also said things, we think he said these things, observe all, evaluate honestly, when it comes to therapeutics, assist nature. Prognosticate when you can. So these are great lessons that any physician, any clinician can really use in caring for their patients even today.
I was going to ask if it's gotten easier or harder to practice medicine since then, but let me take a phone call first. Elizabeth in Talbot County, prolific Talbot County. Elizabeth, thanks for the call. Go ahead.
Yes, I just wanted to make a comment that I had precancer cells at age 20.
Yes, ma'am. And what's the lesson from that?
I think that 21 is a little bit late to have your first PAP exam.
Interesting. Thanks so much for calling in.
One thing I'll point out is that the American College of Obstetrics and Gynecology, I'm not a member of that organization, I don't speak for them, but they do point out that they still are recommending that young women come in for evaluations, come in for pelvic exams, and I think part of that might be because of the great value of that physician-patient relationship, that OBGYN doctor or primary care doctor sitting down with that young lady and just talking about lifestyle, risk factors, ways to prevent illness. So while the test is off the shelf, according to them, until age 21, there's a lot to do in a well visit.
Interesting call, because you wouldn't want to be the person that put off the test and found out something too late.
Exactly.
So how do we make those decisions? At the other extreme, I hear these ads on the radio for, get the total executive checkup where you get the CT scan and they examine every organ in your body. Certainly you're going to get some radiation, but they might find something.
Yeah, they might, but those kind of tests are interesting, and they're I'm sure very interesting to those people who have money who can afford them. But the real sin and the shame is the number of uninsured patients who have no health care coverage, who, say nothing of a CAT scan of somebody's chest and abdomen, can't even get a blood pressure check or a blood sugar test or other types of evaluation that are much less expensive and are shown to have greater yield.
I just have a few seconds. Viewers out there haven't seen the doctor in a long time. What should they do? When should you go in?
Well, I recommend you go in when you don't feel well. I recommend you go in if you haven't seen your physician in a year or two, if you can, and bring to that doctor visit a list of some of the things that are bothering you, that are concerning you, and if nothing else, look forward to having a conversation about lifestyles and ways to prevent yourself from getting sick.
Good stuff. Dr. Richard Colgan of the University of Maryland, thanks for coming by.
My pleasure.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.